Amniocentesis. Introduction. All pregnant women age 35 have a 1 in 178 chance of having a child with a genetic disease.
Select true or false.
Correct. If a pregnant woman is a carrier of a genetic disease, the chance of having a child with that disease is much higher. For example, a woman who is a carrier of Duchenne muscular dystrophy has a 50% chance of having a son with that disease. Amniocentesis may be recommended toward the end of pregnancy.
Select true or false.
Correct. Amniocentesis may be recommended any time after the 15th week of pregnancy. Women who have signs of an amniotic fluid infection may have amniocentesis toward the end of pregnancy to diagnose it. Amniocentesis is more accurate and complete than the quad marker for identifying genetic diseases. Select true or false.
Correct. Amniocentesis is an outpatient procedure.
Select true or false.
Correct. You can go home after the test. Very rarely, if there are complications, the doctor may want you to stay at the hospital for a while. It is normal to feel mild abdominal pain and cramping after amniocentesis.
Select true or false.
Correct. Some pregnant women feel mild abdominal pain and cramping after amniocentesis. This is normal. However, moderate to severe abdominal pain or cramping requires immediate attention. Call your doctor. Amniocentesis identifies all diseases.
Select true or false.
Correct. Amniocentesis cannot identify non-genetic diseases, such as cleft palate and certain mental disabilities. Thank you for using Explain.